Hi, I'm Dr. Michael Golkiewicz, and we are here with Mrs. Walker. She's going to tell you a little bit about what she was dealing with. She's had one adjustment, and it's been 2 weeks since her first adjustment, and she's going to kind of describe what she was going through and how she's responded to the upper cervical care.
I have been dizzy, and I've had vertigo issues for 24 years, on and off. Headaches, and I've had one adjustment, and I feel like a new person. I feel like my old self again. I'm able to drive again. I'm able to walk like a normal person without my cane. I just feel great. I'm just so happy.
Yeah, she's definitely been an overachiever. We called her one adjustment miracle. So I remember the first visit when she came in, we were getting her lined up for the x-rays, and she was literally swaying and she couldn't stop. And I said, like, do you do this all the time? And she's like, yeah. It's like she's always swaying. So
always moving. Yeah.
You're sitting here, you're not swaying.
Yeah.
What? And you said, like, even if you were in the car, if somebody was going to back the car up,
I would usually get out because I couldn't. It would make me nauseous.
So for many years you've had to get out of a car in order to back up.
Yeah, or I would tell them, oh, there's a pull through, just pull through. So we didn't have to back up because it was awful.
Wow. So then you also had a follow-up visit with your doctor this week, and she checked you out, and what did she say?
She noticed that I wasn't swaying. She noticed that my eyes weren't funky because my eyes were like, they kind of moved too on their own. And she noticed I wasn't dizzy or anything. She was like, wow, what'd you do? And I told her that I came here and you gave me one adjustment, and she noticed.
So how would you describe the adjustment? Was pretty light.
It was very light, but I felt like I got ran over by a semi-truck, and you backed it up and ran over me again.
So what was interesting is after we adjusted her, she was laying on her side and she sat up, and you said you thought you were going to throw up. You felt
I did.
Really dizzy.
Yes.
And I said, that's a good thing, because if we move the bone that we think is the problem and it affected the symptoms, that means we're on the right track.
Yeah.
Right?
Yes.
And then that night you said you felt like you got ran over by a truck, everything hurt, and you woke up the next morning and your dizziness was gone.
Yeah, it was completely gone.
That's
and it's
great.
been gone since.
Yeah, so we're really excited for Mrs. Walker. She's had just amazing results here. Stay tuned at the end of this video. We're actually going to show you her x-rays, what we found, and then since we're not adjusting her, she's holding her alignment. We're going to demonstrate the adjustment that we used, just not on her. All right, so this is the Orthospinalogy Laney handheld instrument. It puts out about 2 pounds of force, which seems very underwhelming, not doing much to my finger there, but the atlas bone is about 1 inch under the tissue. So if we can compress the tissue between the skin and the atlas, see how we can cause it to jump. So what we're trying to do is we're trying to move a 2 ounce bone. We're trying to move it a few degrees, and we want to sneak it into place as light as possible so it doesn't actually bounce out of place further. So the adjustments are very light. The adjustment is done with the patient on their side. So we lay them on their side. We have a special headpiece on our upper cervical tables that allows the skull to be supported, and then we can move the person into place and get them set up exactly how we need them. And then we're going to use a protractor. We have a digital level on here and a laser. So we're going to use a protractor to figure out exactly what angle we want to come in at, and then what rotation. And then we're going to use the level to figure out what angle we're coming in at. And then because this headpiece is very firm, that a little bit of force, that 2 pounds, goes into moving the atlas underneath the skull back into place. So we take a lot of measurements of the anatomy of the base of the skull, the top of C2, and we're trying to figure out what angle is going to work the best to slide that bow back in to adjust that as light as possible. So as part of our assessment, we're going to analyze the spine using motion x-ray. So we're seeing dynamic movement of flexion extension, and we're looking at the skull and the atlas and the axis. So we're looking for 3 different things. We're looking for normal movement, we're looking for abnormal movement, and then we're also looking for instability. So if something's unstable, we can't adjust that area. But if something's not moving right, then we can adjust that. And then if something's moving correctly, then the goal is to leave it alone, right? So we only want to work on the bones that are dysfunctional. So we're going to use the video fluoroscopy to look at the whole spine. And then what's really neat with her spine is that the only dysfunction that we found was at C1. So when she moves her head left and right, the C2 is moving normally. The lower spine was moving normally. The upper back was moving normally. So sometimes there are complicating factors in the lower neck that will affect the ability to hold the atlas for long periods of time, or C2 or C3 could also contribute to the vertigo. Certain things in the mid-neck could contribute to the vertigo. So we're assessing here, and all we found was the atlas, so we left everything else alone. And we're going to show you on the next video how we assess the atlas alignment. So this is how we assess the atlas alignment. We're going to start with a side view, and we actually put some metal BBs on the side of the skull, right at the mastoid bone, at a place that we can palpate, and then we reference where those BBs are at to what we can palpate, and then we put a circle where the atlas transverse process is at. So when we're doing the adjustment, we can compare the anatomy to where we feel the BB's at to where the atlas contact is at, so we can get that instrument directly onto the transverse process of the atlas and contact that. So the side view is going to show us a few things. It's going to show us the alignment of the neck. So if is there a straight neck? Is there a reverse curve? Is there an S neck? Is there anterior head loading? And that X-ray is also going to show us what angle the atlas bone sits at. So we can see that her atlas is at 16 degrees. And then we're going to take an X-ray down that angle, so we're looking straight into the atlas. That's called a nasium X-ray, because that will usually project through the nose. A really flat atlas would project through the mouth, and then a real steep atlas would actually project up through the forehead. So we're going to take that nasium X-ray, which is this one right here, and then we have a program that uses the outline of the skull to draw a line that best represents how the head is sitting in space. So if I draw a perpendicular line relative to that, and then this purple line represents how the atlas is sitting. So if we bring this line down, we can see that her skull is tilting to the right into the atlas. So she has a right occipital condyle problem right here. So the next X-ray we're going to take is called a vertex X-ray, and we're actually going to look down through the top of the skull this way to find any rotation of the atlas, and that is this X-ray here. Now this X-ray had the most significant misalignment. Here's the outline of the atlas bone right here, and then we can see the dens of the C2. And when we draw our analysis lines on here, we're going to see that her atlas is rotating backward on the right, and that actually measures 5 degrees. So the only thing that we found in her neck that was causing her vertigo was this 5-degree rotation of the atlas. And from this view, we have a 1.63 degree misalignment. So we can't feel 1.6 degree misalignment by hand. We have to rely on the X-ray to tell us the exact position or malposition of the alignment. And then based on these X-rays, based on the angle the bone's sitting at, how it's rotated, how it's shifted left to right, we can come up with an angle to adjust that bone very lightly and very gently, and push that back in the right direction, and then realign that. And most of the time, people do very well when they get their atlas realigned as far as many types of symptoms go, not just Meniere's. It could be headaches, could be trigeminal neuralgia, it could be jaw pain, it could be neck pain, it could be migraines, it could be low back pain coming from an atlas subluxation. Maybe that's not responding to other forms of treatment. Maybe there's a subluxation in the neck that's causing imbalance in the muscle tone in the low back. So hope you enjoyed a little bit of this journey into the upper cervical world.